How are you today?
Hey guys, I sincerely apologize for running a little bit late. I got sidetracked. I apologize for that. So, Martha Buchanan, MarthaBuchanan, Director of the Knox County Health Department. Thank you again for being here today and for all you're doing to get information out to our community about COVID-19. I want to start with some statements and just talk about some of the things, some of the themes we've been seeing from the phone bank, from you all, from Facebook, wherever we find those information, those questions that are being asked. So first, there's a ton of questions about testing. Lots and lots of questions about testing. People who want to be tested but can't get tested or are unable to get tested. And so one of the reasons for that is that just like any other medical test, COVID-19 testing has guidelines associated with it. So there has to be a reason to perform that test. In medicine, we don't perform a test without a reason to do it. And so COVID-19 is no different than those other tests. There has to be a reason for it to be done. So sometimes that's why a person doesn't get tested. The other challenge that we're having with testing is, we've talked about testing is, there's the collection of the specimen. They stick a swab up your nose and put it in a thing and send it to the lab, and the lab runs the test. Well, they also have to wear personal protective equipment, a gown, some gloves, a surgical mask, some eye protection. All of those things I just listed are in short supply across the country and around the world. Every provider in town, including the health department, is looking for supplies, calling everybody they know, calling every supplier they know to get those supplies. So, again, limited testing, limited access to supplies, and so we're also limiting the people that we test, the people who are most likely to be sick, people who have fever, people who have a cough or shortness of breath. And that's across the board. All providers are following those guidelines, and as you know, health department's following a little more narrow guidelines, because part of our job is to identify those cases of people that truly have disease and make sure we do our job. We isolate them, protect the people around them, and in the end, protect our community. So it's really important that we find those folks. So we're focusing on those highest risk folks to get them tested as quickly as possible through the health department. The other thing is that there's a lot of questions about, I've got a runny nose, I've got a cough. Look around us. It's East Tennessee in the springtime. One of my favorite times of year here, but also one of my nose's least favorite times of year here, because I'm going to cough and sneeze and have allergies. So a lot of us have allergies. We have other respiratory illnesses circulating in the community that aren't COVID-19, that are, quite frankly, in our community are more common than COVID-19 at this time. So all of those things roll into the fact that some people who believe they need to be tested are not getting tested. Some of it is just also that providers are just now it's a new process, and they have to put new things in place. They have to wear a little extra protection to do this test. Think about it, when you go get a flu test done, they don't really put a bunch of stuff on to do that flu test. For this test they do, so it's a change in process for them. So again, not every provider's up and running. Providers want to test, they're looking for supplies, and I will imagine that testing will increase over time. In addition to that, we are working with community partners to see how we could possibly have more of a rapid put-through kind of testing or assessment facility or site where people could come through, determine if they qualify to get tested, and then obtain the test. So again, goes back somewhat to supply and demand, somewhat to having enough people to be able to do that. Because what we don't want to do is open something up and go, well, we can only do 50 people, we're done. I don't think that would be a very positive event for anybody, so we want to avoid that. And I think the other thing is just a little bit about what we, the health department, are doing. I am talking to and or meeting with the hospital executives almost every day. I met with them, I was on a call with them this morning. We're meeting with them regularly and talking with them regularly. And I think the other thing that the community should know is they're working together. They're working together to make sure all the hospitals have supplies. They're even willing to share supplies. They've opened that up. They're working together so that the hospitals can do what they need to do to protect our community. And I think that's a great message for everybody in our community, because we need our medical community to keep doing its job and to work together to accomplish one of the goals, which is reducing the number of people who get sick and reducing the number of people who die from COVID-19. So one of the other goals that we have is reducing the economic impact and the social impact of COVID-19. So part of what we've done is we've convened through the Emergency Operations Center, which is kind of a weird task for them. We've convened a bunch of folks who are focusing on social services. And so we're working on identifying needs, pulling the right people in to help meet those needs for this unique event. So those are kind of a couple of things that we're doing and ongoing. My staff are very involved in that. In addition to that, my staff have really quickly created some web-based or webcast kind of educational tools that can be used by certain sectors. And those will continue to be available online, trying to keep with our social distancing guidelines and making everything virtual. So all those things are going on. We continue to work really hard as a community, as what we call the local public health system. That involves you all, that involves hospitals, social service providers, employers. We all work together to improve or protect the health of our community. So that's what I have to say. So what are your questions?
One quick follow-up there. You mentioned kind of the idea of a high throughput testing site, I guess we would call it. Would that be similar to that kind of drive-through testing that we've seen up in other places? I know that's a buzzword. I know it's in the early stages still.
So yes, right now the concept would be that it would be a drive-through kind of space, and similar to what you've seen in other places, where people, and again, we're just in the early stages of discussing that. So, will people register? How will we get the paperwork done? All of those questions have to be answered. And so, yeah, it would be something probably similar to the drive-throughs that you've seen in other places.
Would that be process and why that's taking?
Oh, sorry. Thanks, Scott.
Would that be a site where swabs are actually taken, or would that be an assessment to where they need to, whether people need to? Would it be a referral?
No, so both things.
Okay.
First step is to say, and we'd love that to be determined before they ever get there.
Yeah.
So first would be to say, do you qualify for testing? Do you meet those medical criteria for testing? And then if they do, to collect those specimens, send them to the lab to get tested.
From an epidemiology perspective, would it be, I know resources are limited, would it be ideal to be able to test a large group of people right now?
It would be ideal to be able to test the folks that need to be tested, and all of the folks that need to be tested. It's really not ideal to test everyone with this kind of test. It's not, again, we go back to the science of medicine and epidemiology. You want to test the people that have the risk for the disease. You're going to get better results and better information with that.
You mentioned, Dr. Buchanan, that every provider in our area is on the hunt for supplies. But we've also spoken on this issue before that our hospitals were prepared. We're seeing staffing and equipment shortages in those harder hit areas of the country. Could you speak broadly on how prepared Knox County is if this were to happen?
Sure. The meeting we had this morning with area hospitals was to talk about just that how do we increase what we call surge capacity? How do they increase their capacity to care for the folks who are coming in that need to be hospitalized with COVID-19, plus all the other people that are coming in with heart attacks and appendicitis or whatever else they're coming in for. So I go back to what's unique, and one of the things I love about working here in Knox County is they're all going to implement those changes together. So they all agreed we'll implement changes at the same time, and so so that the community understands that they are coordinating what they do. So that's part of the plan, is to make those changes to increase surge capacity, and there are a lot of details to that the hospitals will be managing and working through. So I do feel like we're prepared. I do think it'll be a stress on our community and a stress on the medical community. But I think what I've talked about before is that social distancing and all those things that you can do, staying home if you're sick, washing your hands is so vital to reducing infection, COVID-19 or no COVID-19, it doesn't matter. avoiding folks who are sick, trying not to touch your face, which is really hard for me to do. All of those things are going to do what, remember we talked about flattening the curve, so we don't all boom and hit the medical community really hard with a lot of cases. It just kind of slowly goes up, they get stressed, and it goes back down. So.
We don't have that many cases in our community right now. Do you think as this virus spreads, most people in our area will know someone who has it or have it themselves?
It's a great question that I can't predict. I think that we will see community spread. Will all of us be impacted by it? I don't know.
You mentioned social distancing. You've been talking to us about it many times now, but we're seeing in Florida, for instance, a coast there full of spring breakers, and then even in our area, we're seeing people on packed balconies enjoying brunch, enjoying, just as a health professional, getting the word out so frequently. I'm frustrated by those not heeding your warning.
I think right now what's important to remember is we are in the very early phases of this illness in our community. And right now, all we've made are recommendations. And people choose to follow recommendations or don't. Most people are. I would have to say, I experienced it yesterday. A local restaurant that I frequent is now only doing takeout. And so I didn't know that until I got there. And I had to regroup and rearrange my evening, and that was fine. But most people are heeding the warnings and trying to social distancing. We're talking about we've made all of our meetings virtual. I know I have friends who are working from home. I have friends who are doing meetings virtually. So I think most people are, and at this point we don't feel like we have to mandate anything. That time may come, but we're not there at this point.
What's the recommendation for daycare right now? Everything still be
It's a great question. So we just had a pretty large educational session yesterday with our local child care facilities. And the guidance, right now is to do the same kind of things, limit the number of children that are there, try to keep them separated from each other as much as possible. Certain activities we're recommending that they don't do, and limit intermingling. No field trips, that kind of stuff. But the importance of our child care facilities staying open for moms and dads who have jobs is vital to our economy and to those families. So we want folks who have alternatives for child care to seek out those alternatives. Folks who don't have alternatives, that we're working with the child care facilities to remain open so that they can do that safely.
As far as hospital future care, do you know how many ventilators are ready to go in Knox County?
I do not have that number on the top of my head.
Can you talk about, we've seen a lot of that coverage, can you talk about why ventilators are important for respiratory illness like COVID-19?
Sure. Any respiratory illness can impact your lungs enough that you can't breathe on your own. That actually, it's really about the oxygen exchange. If they get too infected, you can't exchange oxygen efficiently, and so you have to have help from a ventilator. And there are all kinds of different ventilators that are out there that are used for different medical reasons. So during flu season every year, we see an increased use in ventilators. And sometimes we even have to start looking at how many we have in the community. So we have that system activated. It's called the Hospital Resource Tracking System, where people put in not just that they have a ventilator, but what kind it is, because not every kind is right for everybody. So I don't know the number, but I do know that we're prepared to be able to mobilize any excess that we don't use regularly for this problem.
Can you speak to whether elective surgeries have already been pushed back or if any movement's been done on that front?
What I can say about that is the hospitals are in discussion, and again, that's one of those things they're agreeing upon how they'll step that out when they decide to do that.
Dr. Buchanan, you said that right now they're recommendations, that you haven't got to the point where you'll have to mandate it. Would that be your office that says, okay, close?
It would be. Under public health law and under my authority as the public health officer for Knox County, I have the authority to mandate certain actions to protect the public's health. It ranges from making somebody take their TB medicine to closing a restaurant. Similar to what the public health officer did in Nashville, we have that authority under the Tennessee Code to do that. That would, of course, be done in concert with our leadership here in Knox County based on epidemiology and where we are as far as disease goes in the community.
Dr. Buchanan talked a little bit earlier about the images of spring break in Florida and all the people on the beaches, people returning from vacations from areas where there might be community spread, New York, West Coast areas, do they need to quarantine themselves for 14 days?
So it depends on where you're returning from. As I've said previously, the guidance for quarantine and whether it's self-quarantine or we monitor you or something else are based on where you went and where you're coming from. So people who are coming back can do a couple things. They can call our office or call the Tennessee hotline that they have set up as well to get guidance on what they should do when they come home. So we're we're prepared to provide that guidance.
When you talk about needing for equipment, obviously it goes to hospitals and clinics. Does that also apply to general practitioners that you're in contact with? And also, since they don't have to follow necessarily the guidelines that you follow, does that, we don't know how many are being tested. Does that run the risk of too many people who don't need to be tested being tested through their private doctor?
Well, physicians certainly can determine how they want to practice, and groups do that. They send out, guidelines for the physicians to follow, and in the end, the physician makes their decision based on that person in front of them and the history of that person and their physical exam. And I think so. When you talk about supplies, we're talking about like personal protective equipment and stuff like that.
Everything that you mentioned
Okay,
earlier.
because that like not ventilators and stuff.
No, yeah,
Okay.
don't use those.
But yeah, sorry. I think private providers are telling us that they are having a hard time finding those supplies. Again, they're all looking to their normal supply chains, and unfortunately, a lot of us use the same supply chains. We're hearing that we will be getting supplies. We haven't seen that locally, but we're hearing that. I don't know the timeline for that at all, but it certainly is being said by the federal government and the state government. So we're hopeful that that'll happen.
My last thought, we're seeing more young people in ICU in the United States and in Louisiana. There's more than projected, maybe. If there was a group of folks who thought maybe this doesn't affect me, now we're seeing numbers that show it absolutely can. I guess, would you reiterate your message to all of the public?
Well, I think what's really important is that something like COVID-19 can make anybody sick, and based on your own personal medical condition, whether you have asthma, whether you have high blood pressure, whether you have diabetes, all of those things are going to impact how sick you get from COVID-19. Your age is going to factor into that as well, but those comorbidities, as we call them, so having other illnesses, other chronic illnesses, will increase the risk that you'll have a complication no matter what your age is.
And
You
this
guys get time for one more question.
is both, a state level thing in some sense, but the fact that the state isn't tracking the number of private lab tests that are being conducted, of course, that's made above your pay grade. But would it help in the response here to know how many private lab tests have originated in Knox County and what can, of course, we know the positives, but I mean, if we do the overall number, would that help you in your response?
Not really. No, honestly, knowing the positives that's the information that we need to do our job. We don't need the information on negative tests to be able to protect the public. Our job is to reduce the risk of people getting sick and reduce the risk of people dying from illnesses. And so knowing those positives, we're able to do that job by isolating those cases, educating the people around them, keeping an eye on them if necessary, getting them tested if needed. So that's really what we do, and that's really what's going to help. In addition to all the things we're doing now, that's what's going to help reduce illness in our community.
If I can piggyback on that real quick, the lag in time from the sample is taken to when you get the results back from the test. Some private providers are saying it's a week now. Does that hurt you guys figuring out the problems here?
Well, it is a challenge. Lag time for testing is a real challenge for us and for the people that are being tested. So if you get tested for COVID-19 you are asked to stay in isolation until that test result comes back. So for somebody who's negative, if it takes a long time to get the test result back, it's extending the time off from work. Somebody who's positive, they're going to have to stay a little longer anyway. But for those negative folks, it's really inconvenience. It's a real inconvenience, and so I know they're working on trying to increase capacity to do testing more rapidly. But lag time is a challenge for us, definitely.
Thank you very much.
Thanks everybody. Thank you.